Welcome to The Explainer. Autism Spectrum Disorder, or ASD, it's a term that gets thrown around a lot. But what does it actually mean? What's it like to navigate the world from that perspective? Well, that's exactly what we're going to dive into today. We're going to go past the textbook definitions and try to build a real, a more human understanding.
All right, so here's how we're going to break it all down. First, we'll get a solid handle on what ASD is. Then, we'll look at its key features and challenges. After that, we'll dive into how we can actually provide support, the framework for care. We'll also talk about the super important role of family and community. And finally, we'll get to the big question. What's the goal of all this? Hint, it's all about quality of life.
Okay, let's get started. First things first, we need a really solid foundation for what we're talking about.
So, right off the bat, let's be super clear. ASD is not a disease, it's not a behavioral choice. It's a lifelong neurodevelopmental condition. And what that really means is it's about how the brain is wired from very early on. And that word spectrum, it's probably the most important word in the definition, seriously. It means that autism looks different in every single person. It's not a one-size-fits-all thing. Every individual has their own unique blend of strengths and challenges.
So, the natural next question is, what causes it? And the honest answer is, it's complicated. There's no single thing. All the research points to this complex mix of factors. We're talking genetics, biology, maybe some environmental influences. They all seem to play a part. So if you take away one thing from this, let it be this. ASD is multifactorial. The idea that there's one simple cause? That's just a total myth.
Okay, so if it's a spectrum and looks different for everyone, how is it even diagnosed? Well, it turns out that diagnosis usually zeroes in on two main areas where people with ASD consistently face challenges. So those two core areas are, first, challenges in social communication and interaction, and second, restricted and repetitive behaviors. Let's unpack that. The social side might look like struggling with the natural back and forth of a conversation, or maybe finding it hard to read body language and social cues. Then you've got the other side of the coin, restricted and repetitive behaviors. This can be things like stereotype movements, maybe hand flapping or rocking. That can be really comforting. It can also mean a deep need for sameness and routine, or having these incredibly focused, intense interests. And sensory sensitivities fall under this umbrella too. Being extra sensitive or maybe not sensitive enough to things like bright lights, loud noises, or even the texture of clothes.
All right, so once we understand these challenges, the big question becomes, so what do we do about it? How do we help? And the answer isn't just a bunch of random tactics. It's about building a really thoughtful, structured framework for support.
Professionals, like nurses and therapists, use this really clear step-by-step process. Honestly, the best way to picture it is like building scaffolding around a person, not to confine them, but to give them the support they need to climb. It all starts with a really comprehensive assessment. You have to understand the individual's world first. From there, you can set meaningful goals and then create interventions that are totally tailored to them. This is the absolute opposite of one-size-fits-all. It's a custom-built support system.
So what does this support or intervention actually look like in real life? Well, it can be a whole range of things. It might be something as simple as creating a very structured, predictable environment to help lower anxiety, or using visual aids like picture schedules to make communication clearer. It definitely involves proven behavioral techniques and strategies to help manage all that sensory input we talked about. And this is so important. It also means providing support, education, and counseling for the family. They're on this journey too.
But here's the thing. This isn't just something that happens in a clinic or a doctor's office. Real effective support, well, it takes a village. It requires a whole ecosystem of people. So, if the professionals are just one piece of the puzzle, who else absolutely has to be involved for this to work? You can think of it like this. At the very center, you have the individual with ASD. But surrounding them, you have this whole network. You've got the family and caregivers. They're the MVPs, the ones there day in and day out. Then you have the healthcare professionals and the educators in schools, bringing their expertise. And wrapping around all of that is the community. Friends, neighbors, support groups, everyone working together to create a space of acceptance. It's a team sport, for sure.
And this quote from the source material just hits the nail on the head. It says, "Active family involvement is essential.
community awareness is needed to reduce stigma and foster acceptance. You see, you need both. You can have the best therapy in the world, but without an involved family and an accepting community, it just doesn't work as well. That combination, that's what makes this whole thing truly work on a human level.
So we've talked about the challenges, the frameworks, the support systems. But what's it all for? What is the actual ultimate goal here?
And this might be the single most important point of our entire conversation. The goal is not, I repeat, not to cure autism, because autism isn't something to be cured. It's a core part of who a person is. The real goal, the only goal, is to improve their quality of life and to build a world that includes them. It's about giving people the support and the tools they need to flourish, just as they are.
And how do we know if we're succeeding? Well, it's not some abstract idea. We can actually see it. We see it in improved communication skills. We see it when challenging behaviors decrease because needs are being met. We see it when someone can participate more in school or their community. And, just as critically, we see it when caregivers feel more confident and less stressed. It's a win for everybody. So as we wrap up, this all kind of brings us to one final big question. And it's not just about understanding autism. It's really a question for ourselves. What can you and I do in our own daily lives to help build a world that's just a little more accepting, a little more supportive for everyone on the spectrum? That's a thought I want to leave you with. Thanks for joining me on The Explainer.